Good afternoon, Auto HIMSS members. Thanks for joining today's webinar. It is my pleasure to introduce today's speakers, Adam Rosenberg, who is the Director of Healthcare Strategy for RX Review, and Hope Gianetto, who is the Director of Provider Growth for RX Review. If you have any questions for our speakers, please enter them in the Zoom chat. And with that, please take it away, Adam and Hope.
Well, thank you so much, John. We're really excited to be here. There's been a lot of progress in the price transparency space across the last, decade, but especially across the last year. And RX Review has really specialized in creating an interoperable network to improve decision-making for providers at the point of care. So Hope, I don't know if you wanted to introduce yourself really quickly and then we can dive in.
Yes, thank you, Adam. So I'm Hope Gianetto, the Director of Provider Growth for RX Review, and really out in Denver, Colorado, covering the West Coast. If you do have any questions, please don't hesitate to reach out afterwards. We'd be happy to do a demonstration one-on-one or further to discussions. Thank you.
Great. Well, so for today's agenda, we're going to give a little bit of background and level set everyone on price transparency, and then the drivers of why price transparency is important today, and why improving prescribing workflows are helping in the fight for price transparency. Then Hope will dive a little bit deeper into real-time prescription benefit and what that is and how it works, and then best practices for how to roll out a real-time prescription benefit solution. And then we'll save some time at the end for Q&A. So the current state of price transparency, there has been a ton of progress, like I mentioned, across the last couple of years in terms of price transparency and providing better data at the point of care, but we're not there quite yet. We haven't created a truly interoperable network and a truly interoperable healthcare system where doctors know exactly what it's going to cost every patient for every service. We've done a lot of research in this topic. Price is still the #1 issue in medication adherence and access to prescriptions. And when we surveyed prescribers and providers last year, 79% said that they rarely trust the information that is in their EHR. 87% of patients said that they would like their providers to share cost information. And physicians just have a really negative experience and say that prior authorizations have a negative effect on patient experience and clinical outcomes. So there's a lot of hurdles that are still in place in terms of getting price to the point of care and getting patients on medication or on the right service. Now, there's been this big push from a policy perspective, and on the left side of the screen, there's kind of just a brief highlight of some of the recent policy changes. Not only are information blocking rules in place and interoperability policy being pushed forward, but price transparency policy is also requiring price transparency or more transparency into patient costs. The rules are continuing to come, and in particular, rules have already been rolled out in the prescription price transparency space that require its use, require tools that connect PBM and payer formulary information to EHR workflows. So there's been a lot of progress specifically in the prescription space. But on the other side of the coin, these big players are investing in this space. These incumbents are making a move and investing in technology, and health systems and EHR vendors really should be aware and take the reins so that they can build out and own these processes before they're forced upon them. So what technologies are out there? We're going to focus a lot on the e-prescribing workflow today, and specifically on real-time prescription benefit. So there's obviously a number of large electronic health record vendors out there. What real-time prescription benefit does is really connect the payer and PBM formulary and benefit information and bring that to provider workflows so that when a prescription decision is made and a medication order needs to be sent, it can very easily be sent through the e-prescribing workflow. There are lots of other vendors on this screen, and if we want to have other conversations about some of them, we can. But for the most part today, I just wanted to level set that we'll be talking specifically about the point of care price transparency, and that's typically housed within a real-time prescription benefit solution. So let's talk a little bit about the drivers of price transparency and what's driving this workflow innovation. First, patients. Patients have really been struggling to have a voice in healthcare, but they want a sense of choice. They want a sense of empowerment. They want to understand what choices are being made, when, and why. That's really been impossible until now, until the data has made its way to the EHRs. But especially across the last year, patients have also wanted to save on their healthcare spend. Now, some of these numbers on the right side were pulled last year in the height of the pandemic, but I still think they hold true. COVID-19 brought additional financial hardships and cost consciousness. Consumers are continually becoming shoppers for their care and are looking for ways to save on their healthcare spend. And a study from PwC said that 22% of survey participants are looking to adjust their prescription spend this year. So there's a lot of influence that patients might have in terms of driving price transparency. Secondly, providers. Providers are begging for better data at the point of care. They want to avoid prior authorizations and reduce administrative tasks. They want to get patients on the right clinical therapeutic on medications that are covered so they don't need to deal with all of that administrative work. And they want to do it all within their standard workflow so they don't have to look for coupons outside of the workflow or leave the EHR to look up additional information. There's a ton of burden and friction in the provider workflow, and we really want to figure out how to ease that as much as possible. And lastly, health systems should be and can be pushing towards price transparency and interoperability. First, improving workflows can save time and can really save money. But more importantly, it can also lead to better clinical outcomes. If the patient comes in the door and is able to get on the right medicine at the right cost, they're much more willing to adhere to that care. So it really is a win-win-win, and it should be a win-win-win across patients, providers, and health systems. All of this is to say, all of this new technology that's coming out, all of the policy that's being rolled out, it really is all putting the patient back at the center. It's not just about opening networks and sending data between different entities, but allowing patients and providers to have a conversation about the cost of their care and allowing them to get better care. The rules and the technologies that we discussed kind of just help to do that. All right, so I'm going to turn it over to Hope to talk more specifically about real-time prescription benefit. It's really just a great example of when technology and policy align to provide better care.
Thanks, Adam. So today, when your providers and your patients are meeting and they're agreeing on a drug therapy, if you don't have your real-time prescription benefit tool activated, or if you've not connected to a third-party vendor within your EHR, today they meet, they decide which medication, that medication sent off to the pharmacy. As that patient arrives at the pharmacy, they have no idea what the cost is to pick up that prescription, right? So a third of prescriptions being abandoned today, because of cost, we can really start to reduce that number by providing cost transparency, one, at the point of care, but also providing therapeutic alternatives at a lower cost. So once you've turned on your real-time prescription benefit tool, it gives your physician the opportunity within just a few clicks and seconds to surface alternatives. So as you can see here, as they're going to pen this prescription, there are some alternatives or an alternative that is suggested that's saving that patient almost $100 to pick up that prescription. So really being able to, one, the patient know exactly what they're going to pay when they land at the pharmacy, and two, ensure that they're actually going to pick up the prescription and adhere to it. So how does real-time prescription benefit work? With a direct connection to payers and PBMs, your clinician meets with the patient, they decide what the diagnosis is. That prescription then is placed within the EHR. It's going to ping the PBM to ensure that we are taking a look exactly at that patient's specific coverage to ensure that the cost of that prescription that appears on the screen is exactly what that patient is going to pay at the pharmacy. So active real-time information at the point of care. So when your doctors go to start a prescription order within the AHR, there are two different ways that this information can be shown. So when they hit submit, that medication and pricing appears on the screen with alternatives that would be covered by that patient's insurance. Or the provider can be proactive. So they can press the pricing request button to understand what medications might be covered with what alternatives. And then a few things that we're doing behind the scenes to ensure that we are really surfacing alternatives, more often than not, is really providing some translation. So looking at quantity unit of measure, right? So your physician is thinking in terms of a vial, a pill, or a tablet, where the PBM might be measuring that by milliliters or grams. So we want to make sure that that translation is happening behind the scenes. And then there can also be multiple NDC codes for the same drug. So we want to make sure that those are also matching. And again, we're surfacing the cost of medications or those alternatives as often as possible for your patients. So here is just an example. And here I want to just kind of put to rest some of the rumors around all payer solutions, if you've heard that term within the industry. So one, there cannot necessarily be an all payer solution because not all payers and PBMs have turned on RTPB or real-time prescription benefit to date. And two, with a direct connection, again, we want to ensure that the cost of the medication that surfaces is exactly what they're going to pay when they pick up that prescription at the pharmacy. So in this example, you have a patient that's type 2 diabetic, so they're going to need ongoing medication. Here with a real-time prescription benefit direct connection, it would lead that physician to let the patient know to pick up that prescription, it would be $348. An all payer solution, so really looking at historical claims and giving an average cost that that patient would pay for Trulicity, would have led the physician to tell the patient that that prescription would be around $75. So you can only imagine that there's a lot of frustration when you arrive at the pharmacy and find out for, almost $250 more it's going to cost to pick up that prescription. And what are the chances, one, of that patient adhering, or two, that's when those phone calls start coming back to the physician's office looking for an alternative, which could have been solved right there at the point of care. All right, I'm going to pass it back over to Adam. Thank you.
Great. So we've rolled out real-time prescription benefit at hundreds of health systems across the country. And we work with a number of different EHR vendors, which Hope will discuss a little bit later on. It really is one of the few technologies in healthcare that is a win-win-win for the patient, for the provider, for the health system, and for the plan. Even so, the industry hasn't seen massive adoption of this technology. There are some large players, there are some small players, but providers aren't necessarily using this functionality day in and day out. And what we've done is pulled together some of our best practices and kind of listed out the tips and tricks that we kind of have focused on in terms of getting doctors to use this type of technology. So first, making it seamless in workflow. This is table stakes, making sure that your real-time prescription benefit data feed is populating inside of the EHR so that the physician does not need to leave their workflow. They can see the prescription pricing right when they're interfacing with the patient. The other thing that's also table stakes is providing training, highlighting why this tool is valuable for them, why it's valuable for the patient, educating the teams on the physicians and the physician leaders on how to use the tool, and leveraging reporting to understand how it's being used. So those two buckets on the left side really are the baseline of how to drive adoption and engagement in these tools. But on the right side, what we want to focus on more is providing better data. And that's really where RTPB vendors can really span the spectrum in terms of success or not, in terms of implementation. So what we've done is outline 4 different examples of why data and the accuracy and specificity of that data is really important. The question that we get all the time is, aren't you just supplying more data into an already cumbersome workflow? Isn't more data just more noise and creating more friction? And what we hear from our provider partners is that if you provide the right data, you can actually create a better experience. So this example on the right side, just one example of how we are providing data not typically seen in the EHR. This physician has ordered a medication, and we provided a medication, the same medication, but it's available at a different pharmacy that might be closer to that patient, or it might be within the health system network. So again, that is not data that's typically seen, but it's creating a better conversation between that patient and the provider. So again, data does not necessarily always equal more noise. If you provide accurate data, it can create a better experience. Secondly, we did a recent survey and found that providers often fall into patterns, prescribing patterns that they're familiar with. Providers will prescribe drugs that they know the pharmacy has access to, and it's a seamless experience for them, but they don't necessarily check coverage. So what this example is showing is a prescriber can choose a specific medication, and the real-time prescription benefit technology can suggest alternatives that are in the same drug class, but are different, that are different medication or different therapy that the provider might not be familiar with. And they can do a little bit of research, but again, it creates a better experience for the patient, who can now save over $125, avoid a prior authorization when they get to the pharmacy. So again, a second example of how using data to your advantage can avoid burdensome PA processes. Thirdly, similar to the example Hope went over earlier, we should be providing options that are covered under that patient's formulary, regardless of the quantity or the drug dosage form. So this example, doxycycline, switching from a tablet to a capsule can save the patient $150. That, again, is not information that is typically seen in the EHR, but we're sending accurate real-time data to the provider so they can make a better decision. And then lastly, doing a lot of testing around what works and what doesn't. We ran a study with one of our partners in Colorado and understood that if we expanded price thresholds for medications, nearly 40% more options would be shown at the health system's internal and mail order pharmacy options. So not only is it a benefit to the health system to keep the patient within the system, but we're actually creating a more convenient experience. Most patients were willing to spend an extra 2 cents, 10 cents, $1, $2 to pick up the medication across the hall. This is data that is not typically found in the EHR, and we've really learned and understood what data is important and what data can make a difference for the providers. And why this is important is the fact that influencing provider behaviors can really make a huge difference for patients and for healthcare organizations. So we worked with one of our partners after implementing a lot of these best practices and found that nearly a quarter of the physicians were making medication switches that led to over $80,000 in patient savings. Now, it's real money. And they avoided restrictions more often, avoided 4.1% of restrictions, which could be prior authorizations or quantity limits. And it's really a simple way to get data to where it matters most, at the point of care. So I'm going to turn it back over to Hope, who's going to walk through the value of RTPB and walk through some quick examples.
Thank you. So what is key by implementing or activating RTPB within your EHR? So one is really empowering your patients. So having those financial discussions up front so they know exactly that pricing information, what they're going to pay for their prescriptions, and are there alternatives that can ensure that you're going to improve drug adherence across your patient population. For providers and healthcare systems, it's really time savings. So reducing the amount of phone calls, whether it's due to a prior authorization or someone in your office that's doing the research behind finding a therapeutic alternative that's going to provide the patient the same results, but ensure that they can financially afford that medication. And then really for PBMs and health plans, reducing some of that administrative burden, making sure that the prescriptions that are being filled are on formulary, being able to really improve patient experience, which ultimately improves their member health and their experiences when visiting with physicians. Again, just kind of really looking at adherence, price transparency at the point of care. And I think we are all not only wanting it, but almost expecting it today. So here is going to give you just 3 examples of how we were able to reduce medication costs for patients. So here, looking at a chronic brand medication, you can see the physician was going to order the patient Januvia. There is alternatives, 3 listed here. So if you were to look at the first one, Tradjenta, for half the cost. So that patient is able to pick up that prescription for $125 versus $250. You're also able to avoid a prior authorization, so saving administrative time on the back end. Looking at generic medications here, just by simply changing the percentage of a topical solution, you're able to save that patient around $90. And then for a chronic medication, as you can see here, there's a significant difference, right? So an annual savings for this patient of around $1,500. Again, kind of looking at whether they're able to adhere and financially afford those medications or not. So just 3 great examples of how within just a few clicks and seconds, you can really save your patients money and ensure that they're adhering to those prescriptions.
Great. And all of the best practices we've talked about today are applicable regardless of your EHR vendor, regardless of your real-time prescription benefit vendor. Like I mentioned at the beginning, there are a number of providers out there who deliver prescription pricing information to the point of care. We have worked closely with our partners to create the best experience for patients, for EHR vendors, and for providers. So Hope, I think you'll continue here. Yep, one last section about who is RX Review.
Great, thanks, Adam. So kind of looking at our partners and members, today Rx Review does have over 150 million members, over 200,000, excuse me, 2,000 healthcare systems out there on board currently utilizing our real-time prescription benefit tool, and over 200,000 providers. So if you take a look at the left-hand side here, these are our direct connections. So our direct connections do include ESI through Prime Therapeutics. You're covering your Blue Cross Blue Shields within the United States, Optum and Humana. And then on the right-hand side here, you'll see that we currently, if you have Cerner or Athena, Cerner, you would have access to our real-time prescription benefit tool. Athena, here soon, you will also have access. And obviously, as Epic is structured a little bit differently, we're bringing on one Epic healthcare system at a time. In addition to that, you can see in the middle of the screen, we're just listing out some of the hospitals that are currently on board with us, specific to Epic clients. And, to really touch on this component of it, we are the vendor in this space that is healthcare system owned and collaboratively led. So they are the ones pushing us to continuously provide, one, the best product on the market today, and two, to continuously innovate our product. So as you're seeing the hospitals listed here, they're also utilizing our real-time prescription benefit tool. And then just, go ahead. I'm sorry.
No, I was going to say, I think we've spoken a lot about prescription price transparency, and that is the area where there's been a lot of tailwinds from a policy perspective, from a technology perspective, and it's really great to see that there has been a lot of progress across the last couple of years, knowing how much investment is going into the prescription and pharmacy benefit space. And it's really exciting, but there is new legislation coming that's opening up additional data. And we're just starting to see similar capabilities open up for all types of services, so that in addition to pharmacy information, medical benefit information is going to be able to be delivered to the point of care. And it's really creating a more seamless, cost-effective experience for patients. So we're really looking forward to not only continuing to deliver prescription information to the point of care, but also just a more interconnected, transparent healthcare system overall. So we will open it up for questions. John, I don't know if there's anything from your end. We can always answer some questions that we typically get on these calls, and then we can end early.
That sounds great, Adam. Let's start with those typical questions, if you don't mind.
Perfect. So Hope, one of the questions we get typically, I have them jotted down on my other screen. Does the pricing information only show when patients are covered under certain plans?
So yes, your patient has to be part of one of our direct connections today to show or provide cost transparency with prescription fulfillment today. Now, keep in mind, we do have a unique partnership with GoodRx. So if you have a patient that's insured, but they're not part of one of our direct connections, you do have the capability, and by your choice, as to whether you would like to surface GoodRx pricing or not, but ensuring that you can still pass along some type of savings to your patients.
Great. One of the other questions we get a lot is, how do providers feel about a tool like this? And we've done a number of surveys with providers. We work really closely with leadership teams and directly with doctors. And what we've found, kind of alluding back to the best practices, is that when the data is accurate, they're much more likely to use this tool. We know that our transaction rates from our PBMs to the EHR workflow is in the high 90% rate, which is at least 10% more than any other vendor in the space. And that's coming from our clients. And why that's important is that if the tools aren't accurate, if they aren't reliable, they're just not going to use them. Prescription transactions and formulary and benefit information has been around for nearly a decade. And a lot of people have a bad taste in their mouth because the data has historically not been accurate. So we really want to change that perspective. And the providers that use our tool have had really a much more positive experience with it. Last question that we typically get is, what does this cost? And Hope, I'll turn it over to you for that.
Thank you. So there is no cost to the healthcare systems. And I know the next question is, well, then who's paying you? So this service is paid for by payers and PDMs to drive down medication cost and really improve adherence. The only expenditure directly to the healthcare system is 2 Epic interfaces, and it takes around 8 hours to build. Great question.
Awesome. John, anything else we can answer for you?
No, great presentation, Adam and Hope, and thank you for being here today and sharing this information.
Great, thank you so much. Well, if there are any questions from the group, feel free to reach out to either of us. We're more than happy to set up any follow-up calls necessary.
Thanks again. Take care, everyone.
All right, thanks, John.
You bet.